Welcome to Lagniappe, a program about events, issues, and people. I'm Cory Crowe. I'm joined today by Alice Prophit from the Living Well Foundation. Alice, good to see you again. Thanks for being with us today on Lagniappe.
Absolutely. Thank you for letting me come.
Well, it's great to see you again, and it's come around. It's been a year, and it's time for the Living Well grant cycle. Before we get into that, tell folks about the Living Well Foundation. What is it that you guys do?
So we were created in 2006 upon the sale of a local public hospital. We are a public charity that operates to the benefit of the public because of the funds that were created from that sale based on local public health, and because it had such a broad region addressed in the application of those funds, we serve 8 parishes across Northeast Louisiana, and we do grants and initiatives off the investment, the earnings. We protect that principle because we're a quasi-governmental agency now still, and we put monies back into that area for medical, dental, behavioral health, health and well-being. Our mission is to improve and support the health and well-being of that population.
So you're basically reinvesting that money from the sale of Glenwood Hospital back into the community.
That's right. When the hospital was sold, because that was a public hospital voted on by the local citizenry, a vote was held to sell it. And so the proceeds from that were put into, I guess you would call an endowment, and we do the grants and initiatives off of the earnings. And with interest rates going up, we are beginning to experience the ability to put more monies than we even have before into the populations.
So you've got funding there for local organizations. You're asking for plans. You want to know what type of projects that they would use that money for, right?
That's right. So we put out the information for the grant cycle, and we're doing that right now through grant seminars. We're teaching some grant writing approaches so that someone could write a grant anywhere if they need to, and we try to help people with that. And then we talk about the cycle and what's going to be what we call the priority and the focus. Because we do one grant cycle a year at this time, we have a pretty broad perspective on what could come in as a request. And we encourage, if they're a nonprofit, a government agency, a nonprofit healthcare, state colleges and universities, education settings, school boards, they all qualify to come ask for grants. So, what are the things now affecting health and well-being for populations? It may not just be directly related to the medical, dental, or behavioral health, but it could be things that are influencing populations from the education perspective, literacy, gaps in other services that they may need help with. Food disparity is still a huge issue across our region, and so support for those programs as well as the broad medical and health perspectives can be supported through funding. And we encourage people, if they qualify, to come ask for money, because you never know within a cycle where the board may be able to put some funds to use. We are looking for large impact projects, of course. If we could create the next school-based health center or trauma center or something that is of that size, we certainly support that, while we also look at programmatic approaches.
It doesn't have to necessarily be health related anymore. You said after the pandemic, things sort of shifted, and what we think of as health-related things are a lot different now.
That's right. It's pretty broad. We do have our restrictions and guidance on what we have to comply with within our bylaws per the structure of the foundation, but our board is looking at the broad perspectives now of what is affecting behavioral health these days, work situations, other access to needed services, whether it be education, literacy, work support. We have looked at, of course, how to add to our healthcare professionals in the environment. There's a big gap in every area, and we're all experiencing that when we call them up. So we want you to call us. The foundation number is 318-396-5066. Go online at www.livingwellfoundation.net and see how to access.
We're speaking with Alice Prophit with the Living Well Foundation. Now, the cycle is going to run. You've got to be absolutely done and completed April 26th, May 31st is
That's right.
the absolute drop-dead deadline, right?
That's right. The software will not open online until April 26th to begin the process. But once you start, you have to be completed by May 31st.
Tell me some of the projects here just throwing something at you,
Sure.
but just in your recent memory, what are some of the big projects that have had an impact, that have gone through and been awarded money from Living Well?
Well, of course, we are very big on putting nonprofit school-based health centers in schools and on campuses. We do dental hygiene clinics. We work closely with ULM in that. And we've done, with Children's Coalition, we're doing suicide intervention and prevention in the schools. And so some of the large projects in that way across the parishes have been in some of those areas, as well as other supportive local community projects.
Do you know, I just asked this one, over the years, how much money is Living Well reinvested back into the community? I hate to put people on the spot sometimes.
It's my job to know that. Absolutely. I'm proud to talk about that. Over $8.5 million since 2008 has been put into the 8 parishes, and over $3 million has been put into school-based health centers, and almost $1 million in dental health clinics. So just to give you that broad brush.
Let's talk a bit about your grant writing seminar. You had one just a couple of days ago. You have some more coming up. What are the kind of things you learn at a grant writing seminar?
Well, we teach what funders are looking for and seeking in projects, and we teach about those perspectives. We teach about writing an application, writing a project, how to focus on that, the financial aspect part, the structure of your nonprofit or agency, on how a funder will look at that. So all those things are taught. We'll have one March 26th. Just show up if you want to, 9 o'clock.
For folks to find out more about the Living Well Foundation, to get involved in the grant cycle and read the requirements, where do they go, Alice?
Call us at 318-396-5066 or www.livingwellfoundation.net.
That's Alice Prophit with the Living Well Foundation. Find out about this and other Lagniappes by visiting our website, KEDM.org. And don't forget, Lagniappe's available on all your favorite major podcast platforms, and our videos are available on YouTube.